This video will discuss anal fissure. Anal fissure is a small tear in the lining of the anus, as is shown in this image. The anus is the opening where the stool comes out. It usually happens when hard stools cause damage to the lining, resulting in a tear. It can also happen when stools overstretch the anus. The anal tear results in spasm of the anal muscles, causing a decrease in blood flow, which then prevents healing of the anal fissure. It is common in people aged between 15 to 40 years, but can occur at any age. Most of the anal fissures are located in the midline, usually at 6 o'clock position. Sometimes it can be located at the 12 o'clock position. Let's now look at the common causes of anal fissure. Passage of large and hard stools damages the lining of the anus, resulting in a fissure. Constipation, persistent diarrhea, and anal intercourse. Less common causes include Crohn's disease, which is a condition where there is a chronic inflammation of the gut and is an immune-mediated condition. Sexually transmitted diseases and anal cancer can also present with anal fissure. Symptoms of anal fissure includes bleeding, especially when passing stools. The blood is bright red in color and is separate from the stools. Secondly, there is pain in the anus. The pain can be a sharp pain or burning sensation or itchiness at the anus, especially when passing motion. Another symptom is a crack that is felt in the skin of the anus, sometimes with a small lump at the anus. The doctor will diagnose the condition by examining the anal area. The doctor may also perform a rectal examination by gently inserting his finger or passing a small scope called an anoscope through the anus. These examinations are only done if it doesn't cause pain to the patient. Sometimes the doctor waits for the anal fissure to heal before performing a digital examination or inserting the scope. Let's now talk about the management. Sitz bath. A sitz bath is a container which is partially filled with warm water. The anus is then immersed in the warm water for about 15 minutes, 2 to 3 times a day. This helps to relax the anal sphincter and improves blood flow to the anal lining. It also cleans the anus. If possible, this is best done after bowel movement. Do not put salt or soap or shampoo into the water. After the bath, the anal area is gently dried with a towel or blow dryer. Paracetamol or other painkillers to relieve pain might help. If constipated, increase fiber in the diet to at least 25 to 30 grams of fiber per day. Laxatives which contain psyllium like fibrogel or metamucil can increase the size or bulk of stools. Another laxative called lactulose can soften the stools and make it easier to pass. Ensure adequate intake of fluid, at least 2 liters per day. Petroleum jelly, for example KY jelly, might help to smoothen passage of stools. An ointment or suppository containing a combination of a local anesthetic like lignocaine and a steroid might help. Local anesthetic will ease the pain and the steroid will reduce the inflammation. Apply before bowel movement or going to bed. It is advisable that steroids are not used for longer than 2 weeks because it might thin the lining of the anus, making it more susceptible to trauma. Examples of this combination medication include Zyloproct and Proctosedil. Topical nifedipine in the form of a cream or ointment or topical diltiazem 2 to 4 times a day can help to relax the anal muscles and increase blood flow. These drugs are called calcium channel blockers. An alternative is topical GTN or nitroglycerin 0.2%, which also relaxes the muscle. All of these ointments are usually started 1 to 2 weeks after onset of the anal fissure and continued for at least 6 weeks or until the fissure heals. Unfortunately, these preparations are not available in many countries. The main side effect of these preparations is headache. However, topical nifedipine and diltiazem has less side effects compared to topical GTN. About 9 out of 10 patients will heal within 8 weeks. These medicines are usually initially given for 4 weeks. If the anal fissure doesn't heal, the above treatment can be continued for another 4 weeks, for a total of 8 weeks. In about 9 out of 10 patients, the anal fissure will heal within 8 weeks. If it doesn't heal within that period, then it is called a chronic anal fissure. Beyond 8 weeks, other options will have to be considered. These options would include referral to a colorectal surgeon for surgery called lateral internal sphincterotomy. The operation involves cutting a small portion of the anal sphincter to reduce spasm and pain and thus promote healing. This operation has over a 90% success rate in good surgical hands. A small number of patients will experience incontinence or inability to control bowel movements after surgery. Fortunately, this is temporary, with recovery after a few weeks. Another option is to continue with topical calcium channel blocker or GTN ointment as mentioned earlier. Another option is the use of oral calcium channel blockers to relax the anal muscle. Examples are nifedipine. An example is a drug called Adalat long-acting or diltiazem. Topical calcium channel blockers appear to be more effective than oral preparations. Both these oral medicines are typically given for a period of 8 weeks. A new type of treatment is the injection of botulinum toxin or Botox into the anal sphincter. This helps to relax the anal muscles. Sometimes a doctor might decide to do an examination called a colonoscopy if there's a high index of suspicion that some other problem like Crohn's disease might be present. Crohn's disease is a condition where there is chronic inflammation of the gut. Colonoscopy is a procedure where a thin flexible tube is passed through the anus to examine the whole length of the colon. How can anal fissure be prevented? Firstly, prevent constipation by ensuring adequate intake of fiber and fluid, and by doing regular exercises. Treat persistent diarrhea. Go to the toilet whenever you feel the urge. Do not strain in the toilet or sit in the toilet for too long. Wipe anus with water or soft material. Avoid rough toilet paper.